Dave Scott, Hub Media. Today I'm going to introduce Nancy Carroll and Lisa Buis. And guys, tell me a bit about yourself and the practice that you're doing.
So Lisa and I have a private practice called Rethink CBT, and we provide cognitive behavior therapy, individual therapy for people who are struggling with depression or anxiety, and then we're just starting to provide group therapy for people who are struggling with insomnia.
Insomnia, wow. Let's talk a bit about insomnia. I read that half the population struggles with it, and 10% is chronic. Can you guys? What is insomnia? What's the treatment?
Even before that was there's a local doctor that had asked me several years ago about if we could treat insomnia using cognitive behavioral therapy. She had actually done some training with other local doctors and found that it was really effective.
Okay.
And of course, up until that point, the only thing that she's had at her disposal to treat her patients who suffer is to be able to prescribe sleep medication. And so they were looking for other options.
Okay.
And what we know is, the research tells us, is that insomnia is actually the #1 health problem in Western society. It's huge. Like, a lot of people are affected, and it can greatly impact people's lives. And so the Canadian Sleep Society has actually deemed cognitive behavioral therapy for insomnia, we call that CBTI. They've actually deemed CBTI to be the first line of treatment, even over medication. So if that's the case, why aren't more people doing it? And the problem up to this point has really been access to treatment. There aren't practitioners trained.
So what we're offering is group therapy, so 6 sessions with a maximum of 6 participants to come and join us and learn skills related to insomnia.
Let's take a little deeper. What is insomnia? Let's break it down here. What is it?
Okay, so all of us from time to time struggle with sleep and have difficulty falling asleep or waking up earlier than we'd like. But there's specific criteria. And the first criteria is that we actually have to be dissatisfied with the quantity or the quality of our sleep. And then there's a few check boxes. We have to either be having trouble falling asleep, we have to be waking up in the middle of the night, or having a difficult time falling back to sleep if we wake up in the night. And then finally, some people just wake up way earlier than they'd like. So you have to check one of those boxes. And then as well, it has to be persistent, meaning it has to have gone on for at least 3 months. And the problem is happening at least 3 times a week. So that's kind of the main criteria.
Okay. And I heard you guys mention CBT. What is CBT?
So cognitive behavioral therapy for insomnia, we call that CBTI, has several components. But the goal is really to help the individual improve their quality of sleep, not the quantity. So that can vary for different people. But the idea behind the treatment, in essence, is to help retrain the brain, reset the body clock, which then allows the body to induce sleep on its own. So it's almost like kind of setting that stage where the body can do what it does. And when that happens, your body will determine how many hours of sleep it needs, right? So that's the body, that can vary among people. How we do that, though, is we gather and collect very specific information throughout treatment about people's sleep. And when we do that, we then give each person a sleep prescription. So that's really important, because even though we're in group therapy, the treatment is actually 100% individualized for each participant. So it's not like a one-size-fits-all.
And there's kind of 3 components to the treatment. So the first part of the treatment focuses on behavior, because we often will, when we have insomnia, we often kind of engage in behavior that interferes with us actually having a good quality of sleep. And so there's a term called sleep drive. And really what that sleep drive is referring to is the idea that we like to use the analogy of a balloon. So it's not our analogy, but we were taught it. The idea that when you first wake up in the morning, and as you go through your day, it's like blowing up a balloon. And when your head hits the pillow, you want that balloon to be as big as possible so that when you fall asleep. And so we teach specific behavioral skills to help individuals so that balloon, that sleep drive, is going to be at its maximum when they go to bed at night.
Wow.
So that's the first component. The other component is related to quieting the mind. So often people who are experiencing insomnia have a lot of anxiety about it, a lot of thoughts running through their mind, and so we teach them specific strategies to help calm themselves, relax, so that when they go to bed, they've got more of a chance that they're going to fall asleep.
A little clearer mind, I guess.
And then the third part of the therapy focuses on kind of the cognitive piece, the thinking piece, meaning that, again, when we have insomnia, we tend to have a lot of thoughts about how much sleep we should be getting, whether we've had a good night's sleep, worried about, I'm not going to be able to function. And so it's about teaching them, again, the myths that there are a lot of myths that exist regarding our sleep. And so really just educating them about those myths and teaching them new ways of thinking about their sleep.
With this form of treatment, is it hard? Is it easy? Like, how do people find this?
And people would report initially that it's very challenging. So I don't want to scare people, but I also don't want to lie. So the first couple of weeks are pretty challenging. And let's face it, people have some pretty long-standing entrenched behaviors that are difficult to change. And so we're asking them to do things differently, and it's difficult. That doesn't last long. Usually by, I would say, week 3, sometimes even before, people start to report some pretty significant changes in their sleep, and it's surprising to them, and it's exciting. And usually by the end, we're hearing things like, "That's the best sleep I've had in years," or that kind of idea. But the analogy I always love to give is if you're haven't been to the gym for a while, or if you're going for the first time and you start exercising, you're sore and it hurts and you're achy, and that's to be expected, right? And so would we tell people, well, just avoid that or just quit? No. I mean, continue and persist, and it will get better, and you will see those gains. It's exactly the same in CBTI. And it's actually where the group therapy model is really helpful, because having insomnia is pretty isolating. People describe, other people don't get it, and they don't get, how I'm suffering, that kind of idea. And well, you're with 6 people who know exactly what you're going through, and it's very supportive. The group can be really helpful in helping problem solve when people kind of hit a wall and they're running into some trouble areas. So it's a really good model to offer the treatment. Yeah.
I gotta ask about sleep medications, like thoughts.
Well, probably the first thing to point out, and it's really, really important, is that people do not have to stop taking their sleep medication if they want to participate in this group. I actually want to repeat that. They do not have to stop taking their medication if they want to participate. And I say that because people can be on medication a long time, and even though they might not like it, for various reasons, they don't want to have to take it or whatever, it's pretty frightening at the thought of not having that pill for some people, right? It's almost like a lifeline to sleep, whether or not it's working or not. So people do not have to stop taking that. If they want to, after group, look at weaning off medication, they can do that in collaboration with their doctor, which is really great, but we don't, that's not a criteria for being part of this group. But the research is really clear that there are serious side effects associated with the long-term use of sleep medication, right? We know that. So dependence, our bodies become dependent on that. Our bodies can build up what we call a tolerance, right? So our bodies are used to that, so that necessitates the doctor to increase it over time, continually, or to keep switching medications. That it's also associated with greater risk for certain diseases like Alzheimer's disease, dementia, certain cancers. So bottom line, being on sleep medication long-term is not good for us, right? We know that.
But what I find really interesting is the fact that people get so, I would call it a psychological attachment to their medication. They've been taking it for years, and it's like, I can't imagine going off of it.
Yeah, it's not working.
But a lot of times when you actually talk to them about their quantity and their quality of sleep, it's not that great. So they have this belief that their medication is really helping you, but if you actually look at their data regarding their sleep, it's not really as effective as maybe they think it is.
Yeah.
False sense of security.
Mm-hmm.
And it's important to point out too, there was one of the sleep medicine doctors at the sleep medicine clinic at the Firestone Clinic in Hamilton. He did talk about, there is a place for sleep medication. So we don't want to kind of throw the baby out with the bathwater, right? There is a place. There are times people might be going through certain treatments for different diseases, or they might be in a really kind of stressful time in their family or whatever, that they're not sleeping well, and we need to sleep. So there is a place, there is a use for these. They're just meant for short-term use. So it's not meant to be a long-term thing.
No, and it kind of fits with each individual differently, as you guys have talked about.
Absolutely.
Talk about costs. Is there a cost with CBTI?
Yeah, so it does cost to participate in the group.
Okay.
The good thing is that a lot of people who have benefits, it's very often covered.
I gotta ask. I mean, this is a really really great conversation. I'm glad you guys have, you've educated me very well on this. Thank you for doing this. But one of the things I wanted to ask a little bit earlier is, with the growing numbers, it's everywhere, isn't it? Like, I
Yes.
mean, it's not just here. It's everywhere. What you had said earlier, and I
Number
don't think
one
we
health
understand.
problem.
Yeah, there
Number
it
one.
is. Number
Yeah.
one health problem, and we don't realize that, do we?
Yeah, no. And I think most of us can say that we know many people
Yeah.
that struggle with sleep.
Yeah.
But most people are surprised that cognitive behavioral therapy actually works. And it really does. So that's like 3 decades now of research where they've compared cognitive behavioral therapy for insomnia over medication, right? So that's why it's been deemed the first line of treatment.
So how do we get people to get in touch with you guys? You got a website, you got phone numbers?
Yeah.
How do they do it?
Yeah, so as Nancy said, our website or our practice is called Rethink CBT. That's our
Okay.
practice. So our website is rethinkcbt.com. And on our services tab, if they go to the insomnia link, there's all the information about the dates that we run groups, the times, the different times in the week, the fees. The other thing that people will find is we will ask them to come and do a consultation with us. So it's like a brief assessment to determine if they actually have insomnia, if they're appropriate for the group, that kind of idea. And we'll teach a lot about how to gather that sleep information. That's the time when we would do all that. And so you can email us through that website. My phone number is listed on that website. People are welcome to call me and ask questions. We also have a Facebook page, which is called Rethink CBT, and that also has a direct link to our website.
And they shouldn't, one of the things I think with people in today's society is they feel anxious about taking that first step, don't they?
Yeah.
But this is all private information.
Absolutely. And we meet with people individually,
Yeah, so-
to determine that, and absolutely.
And we really stress in the group environment too, confidentiality.
Absolutely.
Oh,
So,
yeah, for sure.
You join the group, it's understood that the information that's discussed is confidential.
You guys have had success. Keep it up. I love what you're doing.
Thank you.
It's great to have you guys today and have this chat. Thanks for doing this.
Yeah.